Hello dear colleagues, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 50-year-old man presents with shiny flat-topped papules on the palmar aspect of the wrists. He is mainly bothered by the troublesome and persistent itching. A diagnosis of lichen planus is suspected. What is the most appropriate treatment? A. Refer for punch biopsy. B. Emollients plus oral antihistamine. C. Topical dapsone. D. Topical clotrimazole. E. Topical clobetasone butyrate. Okay, here we have a 50-year-old man coming with shiny flat-top papules on the palmar aspect of the wrist with the diagnosis of lichen planus. Okay, the diagnosis is lichen planus, and the question is asking about the appropriate treatment for lichen planus. The mainstay treatment for lichen planus is topical steroids, as we can see here. Here we have topical clobetasone butyrate, which is a topical steroid, and the choice can be E, or topical clobetasone butyrate. Here we are going to explain about it. Lichen planus. Lichen planus is a chronic inflammatory skin condition that affects the skin, mucous membrane, hair, and nails. And this is important. The patient can the involvement of mucous membrane, hair, and nails. It appears as itchy, flat-topped, purple-colored bumps, often found on the wrist, ankles, lower back, and genitals. When it affects the inside of the mouth, it shows up a white lacy patches or painful sores, and this white lacy patches, we call it Wickham's styria, which we can see inside the mouth of the patients. The exact cause of the lichen planus is not fully understood, but it's believed to be related to an immune system reactions, sometimes triggered by stress, infections, or certain medications. Okay, here we can see the polygonal, flat-topped, purple-colored bumps, which are the features or characteristics of lichen planus lesions. Okay, these lesions are usually itchy. Okay, features of the lesions of lichen planus: itchy papular rash, most common on the palms, soles, genitalia, and flexor surfaces of arms. Rash often polygonal in shape, as we said. The rashes are usually polygonal. White lace pattern on the surface, which we call it Wickham's styria. Kopner phenomenon may be seen. Kopner phenomenon is new skin lesions appearing at the site of trauma. Oral involvement in around 50% of patients. With lichen planus, we can see oral involvement also. And nails, we can see, as we said, we can see the involvement of hair and nails in lichen planus. Thinning of nail plate and longitudinal ridging we can see in lichen planus. Here we can see the oral involvement or Wickham's styria in the patient with lichen planus. Here we can see Kopner phenomenon in the patient with lichen planus. As we said, Kopner phenomenon is forming new lesions in their healthy skin, which previously was healthy because of trauma. The lesions of the lichen planus is formed on the skin. Here we can see the longitudinal ridging and the thinning of their nail plate in patient with lichen planus. Here we can see the Wickham's styria, or we can in their extensor aspect of this of the hand of this patient. Okay, diagnosis. The diagnosis is usually clinical, but sometimes for the confirmations of the diagnosis, skin biopsy can be useful. Lichenoid drug eruptions. Lichenoid drug eruptions are skin reactions that closely resemble lichen planus but are caused by certain medications. These eruptions occur when the immune system reacts abnormally to a drug, leading to a rash that looks similar to lichen planus. As we said, the lesions are flat, purple, itchy, bumps, and often on the trunk and limbs. Common drugs that can cause lichenoid eruption include beta blockers like propranolol, ACE inhibitors like enalapril, thiazide diuretics, NSAIDs like ibuprofen, and anti-malarial drugs, and gold salts and some anti-tuberculosis medications can cause lichenoid eruptions. Management of lichen planus. Okay, topical steroids are the mainstay of treatment of lichen planus, as we said. Benzodiazepine mouthwash or spray is recommended for oral lichen planus. Extensive lichen planus or persistent cases may require oral steroids or immunosuppression therapy. Okay, here was a short explanation about lichen planus presentation and management. We talked about lichen planus and the differentiation between lichen planus and the lichen sclerosus and its management in our YouTube videos. For more information, you can watch them. Thank you for your attention.